Hello, dear doctors. Here we are going to explain another question about cardiology. A 58-year-old Englishman with a past history of myocardial infarction and type 2 diabetes mellitus have a new diagnosis of hypertension. Is currently taking aspirin, atorvastatin, and metformin. What is the single most appropriate medication to be added? A. ACE inhibitor, B. Thiazide-diuretic, C. Insulin, D. Beta blocker, and E. Calcium channel blocker. Okay, the two important point here is the patient's history of myocardial infarction and type 2 diabetes mellitus, and the patient is English, not Afro-Caribbean origin. And the choice will be ACE inhibitor, and we will explain why it's ACE inhibitor. And the age of the patient is also 58, but while the patient has myocardial infarction and type 2 diabetes, the age is not relative. The choice will be ACE inhibitor, and we will explain it here. Explanation. This question is testing your management of hypertension with diabetes. Patients with type 2 diabetes mellitus have a considerably higher risk of cardiovascular morbidity and mortality. Not to mention that hypertension plays a major role in the development and progression of myocardial and microvascular and macrovascular disease in people with diabetes. And treatment in this group of patients is essential. The management for person with hypertension alone differs slightly when compared to the management of a patient with hypertension and diabetes. First line antihypertensive drug treatment in a hypertensive patient with diabetes should be an ACE inhibitor unless the patient is Afro-Caribbean. And age here is irrelevant when the patient has diabetes. Given the benefits of ACE inhibitors in terms of renal protection and retinopathy, it's appropriate to recommend an ACE inhibitor as first line for the treatment of hypertension in most adults with type 2 diabetes mellitus. This is partly due to the positive effect on glucose metabolism. For people of African or Caribbean family origin, an ACE inhibitor plus either a diuretic or a calcium channel blocker is first line. Hypertension management in non-diabetics and diabetics. First line antihypertensives in patients with hypertension alone. If the patient age is below 55, ACE inhibitor is first line. But if the patient's age is above 55 or Black African or Caribbean origin, calcium channel blocker will be first line. And hypertension with diabetes mellitus. The patients which have hypertension and diabetes mellitus in any age, ACE inhibitor is first line, but if the patient is of Black African or Caribbean origin, ACE inhibitor plus either a diuretic or a calcium channel blocker will be first line.